Good afternoon. It's Dr. Lisa with Grapevine Health, and I'm so happy to introduce our guest today. We have Dr. Reed Tuckson, who is the former Chief Health Officer for the Washington, D.C. Department of Health. How are you doing, Dr. Tuckson?
Well, I'm filled with enthusiasm and great love for the lives that we can try to save.
I bet you are. It's great to have you on. I think we have a lot of interesting things to talk about today. But before we get into that, um, tell people a little bit more about who you are and why you're so passionate about health literacy.
Well, I am a physician trained as a general internist, and I, as you mentioned, did have the privilege of serving as the Commissioner of Public Health for the District of Columbia, and went on to do a number of things, including being the president of an academic health sciences center, a medical center in South Central Los Angeles, which was a great experience. And then I spent 14 years as the senior physician at the largest health company in America, United Health Group. And now I'm doing what I do. And in each of those roles, I have come to really be passionate and understand how important it is for us to engage the individual holistically and completely. The things that determine whether we shall live or die, as you so well know, Lisa, are things that involve the combination of our personal health behaviors and also our ability to have the social environment that's conducive to health and that resists the transmission of disease, and then, of course, the quality of our medical care. And so when you look at all of those things, it ultimately involves being able to communicate well. And communicating health information is difficult because by its very nature, health information is scientifically based. The concepts are often complex. The words are often large. And so it becomes very important that if we're going to reach people and be successful, we have to know how to communicate, what to communicate, but also to know how we can help people through the use of information to be able to act on information so that in fact it becomes more than just knowledge, but that it leads to a transformation in behavior.
Yeah, and I can attest, I've heard you speak on many occasions, and I'm always impressed with your ability to make the complex simple for every man. So that really is a gift.
Thank you.
I noticed you've been very active during the pandemic, and we need leaders like you. So tell us what you've been doing. What have you been up to during the pandemic?
Well, you know, we started to think, Lisa, and you know this because thank gosh for your contributions, that we have to understand that communities must be able to take charge of their own health, that you can have wonderful governments. And thank God we have such great public health professionals in our cities these days. And I'm very, really pleased about that. But government can't do it alone. Communities have to be engaged and empowered. And I have learned over the years, Lisa, that every community, no matter how challenged, has its share of assets and resources, that we have to look at our communities from the concept of their wholeness, not their deficit. So we did that in Washington, D.C. and created something called the Black Coalition Against COVID, this grassroots community effort that identified the influencers, the leaders, the voices that have integrity and believability because of their genuineness, their engagement with community. And we were able to capture those people and those voices and have them participate in a multi-stakeholder coalition to advance not only the messages around how to stay safe from COVID, but also to be able to try to create ways in which those messages would be incorporated by individuals in the choices they make every day. And so we've been very active in that and very pleased to see that our community-based infrastructure has been crying out for just that kind of engagement. And also, and Lisa, I think that this is really what has, I think, been eye-opening for me as well, has been that different sectors of the community are interested in partnering with other sectors of the community. That not everybody looks at the world through their own, my lens, my agenda, this is what I do, but in fact, they can see a connection to someone else and beginning to think, how can we harmonize our efforts into an organized, coordinated, cohesive, collective whole that makes the sum of the parts more than the individual.
And I think that's a really important point. But what's missing is the conductor. So you have all of these stakeholders and all these organizations, they mean well, but sometimes there's a lot of overlap in the things they're doing. So I think you're playing a really important role to conduct the orchestra.
Well, if I am, and this is something that I am learning, Lisa, is that the one thing for sure is that what we don't need is a bunch of folks with big egos running around trying to create power bases for themselves. That
Hmm.
now I'm learning a lot more about a concept that I've always believed in called servant leadership. And that servant leadership starts to being able to have multiple leaders all working together and then having each of their skills. You are a servant leader doing just as much. And so being able to find a way for a Reed Tuckson to connect with Elisa, to be able to connect with the community-based advocate who is fighting for returning citizens who had been
Hmm.
incarcerated, and have each of those voices, despite their titles behind their names or what
Right.
their social status is in society, have each of those voices be equal, working
Yeah.
together for the sake of the whole. That has been the thing that animates me the most, Lisa, because it's the way you build for the future.
And I think when this is over, you will have a really, well, I guess we all will have a great story to tell because this is a model that desperately needs to be replicated across the country and across sectors, wouldn't you say?
I think that is absolutely true. And I feel that it's so powerfully inside of me because I believe that we really do need to think to the future, even as we're fighting this fight. If we can create the relationships, and those relationships, Lisa, very much have to do with human caring, being
Mm,
alive enough as humans to care about our fellow person. This COVID epidemic is bringing to light so many side issues, so many big issues are being just illuminated out of the darkness. And one of those issues has to do with our responsibility to our fellow human beings.
yep.
How I behave affects what happens to you in a way that has never been more dramatic. And so the question becomes, do I love you as much as I'm willing to love myself? Do I care about what happens to you as much as I care what happens to me? If we can establish those bonds of ethical and moral and caring and loving framework, then the next stage of the fight will be so much easier.
Yeah, so how do you think we do that? Because this question comes up a lot around the health disparity. So, for example, in Washington, D.C., nearly 80% of the deaths are among Black people. And a huge proportion of those, we talked to the medical examiner, and he told us most of those are people over the age of 60, who many of whom are staying home, many of whom have chronic health conditions, but maybe it's the people who they're coming in contact with, their loved ones, the younger people who need the messages you're sharing right now. So, how do we do that? How do we get those messages out
Well, let's
and have them resonate?
Well, there now you've taken an already challenging question and you made it even more difficult. But it's real, isn't it? It's real
It
what you just
is.
asked. So first of all, let's just acknowledge this is hard. This is
Mm-hmm.
not easy work, and it takes time. Number two, as I've emphasized before, this requires authentic voices, voices with integrity that people will listen to. And oftentimes those voices don't have to have an MD, a PhD, or some government acronym, of a power center behind their names. Just regular
Yeah.
folk are often the most important. Number three, the community and individuals are complex and different. So what works for one segment of the population may not work for another. One of the things that we did as the Black Coalition Against COVID and our team presented was we stopped and did a time for remembrance,
Mm-hmm.
lives lost from COVID. And by the way, if anybody wants to see that, go to our website, Black Coalition Against COVID.org, Black Coalition Against COVID.org, and click on the link for a time of remembrance. And the reason why I emphasize that is listen to the stories of those
Mm-hmm.
who have died, the families telling us about their loved one. But the message that comes through, Lisa, and you watch those stories
Yeah.
is, wait a minute, this virus is serious and it has consequences. And people that we love are dying. These are not statistics that you can just run across on a page in a newspaper or on an internet site. These are
Mm-hmm.
real people that walked among us. And then for our young people, we're going to have a different message. And I'm beginning to understand now that maybe that message is going to have to increasingly be that I may think I'm invincible, but I do have a relationship to my grandmother, and that I have to start thinking about the fact that I care about my mama, I care about my grandma. And these are important, maybe the ways in which we kind of get at this, but each person has their own triggers, and we who are making messages are going to have to think about a variety of ways of hitting those different triggers.
Yeah, yeah, wonderful. So related on this topic of health disparities, so having been a health commissioner, this is not a topic that's foreign to you because we've had health disparities for many decades. But this question about COVID health disparities keeps coming up. Why? Why are we seeing this? Even though we've explained, or some of the explanations are Black people tend to have more or higher rates of chronic health conditions, or less likely to be able to stay at home. But I think it's not as simple as that. So I'm just wondering, what is your perspective on why we're seeing these death disparities?
Well, I appreciate your sophistication in saying that this is a complicated, multifactorial challenge. By the way, simply because something is complex and multifactorial doesn't mean we can't do anything about it,
Right.
or that we're tired. So let me be real clear in describing the problems. Doesn't mean that we ain't no ways tired, as we have learned. But let me slow down and be very careful on the first point. And I want to be very careful in how I say this. We have to, in our Black community, have a conversation about our own behavior. Let's just realize now, we make a lot of choices that affect our own health. And a lot of times, in fact, too often, we are making choices that don't make sense. They're not appropriate. We have to hold ourselves accountable for our behavior when there is the ability to make a choice. When there is an ability to make a choice, we have to hold ourselves accountable. And we as a community have to hold each other accountable for how we behave inside of our communities. So that's number one. We are making too many inappropriate choices and decisions. Number two, oftentimes we don't have the choices that others do because we don't have the kinds of social environment that makes it easy to do the right thing. We want the right thing to be the easy thing to do. But if there isn't a food and supply with fresh fruits and vegetables nearby, it's harder to make the right choice. If we are living congested in neighborhoods with unhealthy environments where the air quality isn't good because of all the pollution from the cars streaming through our neighborhood to get from one place to another, from the suburbs back into the city and back out again, then it makes it harder. So we have a series of social environments, whether it has to do with food security, the quality of our housing, the ability to have recreation. If the police are intimidating our citizens and making it difficult for us to go out and jogging without being fearful that the police are going to stop us for why are we running down the street, that makes it difficult. On the other hand, if we are having violence between our young people and our seniors, making it difficult for our seniors to walk down the street to go to the grocery store, then we got an issue there. So it's complicated in terms of our environment. And then, of course, it gets down to the quality and availability of access to our medical care. And we know that far too many people of color do not have easy or ready access to healthcare, and even fewer to the quality of care that listens to them, that respects them, that takes the time to enforce the dignity of the person and take time to listen to what's going on in their life. We also know that too often the medical care system is disproportionate in terms of the way it interacts from a health treatment point of view with our community. So there are multiple stages in this drama that did not happen overnight. And each one of them has to be dealt with. But I guarantee you, as my final response to this important question, Lisa, at the end of the day, regardless of the challenges, the way in which we will be maximally healthy is when we as individuals take charge of our health and then work together at the level of community infrastructure to support the environment necessary for appropriate individual decision making.
Yeah, so I wanna follow up on a couple of things you said. The first one, and I respect the careful way in which you phrased the need for people to take responsibility for their health. This is a conversation that happens a lot. And on the other side of the argument, people say, when you talk in this way, we're blaming the victim. How do you address that? Because I think it's not fair to completely dismiss the need for us to take care of ourselves as victim blaming.
Well, what happens is that, you know, racist people, white supremacist people, agitators and disruptive people, insensitive and stupid people will often put this on us and make it so that we are afraid to have our conversation, because they do point the finger and victimize and blame the victim for their own victimization.
But some of us do it too, right?
And some of us do it too. So that's why it makes it so hard to have the conversation, because, you know, when you have people like the President of the United States, you know, saying the dumb things that he says, then,
right,
you know, we want to fight back emotionally and say, well, you know, that's not true, or, you know, he puts a context that, instead of being a healing context where you can discuss things openly, it becomes a whole different kind of context. So I think that's what makes it so difficult. And then secondly, again, what people who sometimes want to blame victims for their own victimization are also the very people that are reinforcing the social pathology that makes it impossible to have the social elements necessary for people to be able to make good, healthy choices. So that's the challenge. Having gotten that out of the way, though, there's something that I was taught years ago by a very smart man in Washington, D.C. named Calvin Rollard, who was the publisher of the Black newspaper in D.C. when I was coming up. And what he always used to say is, no people but a people can save a people. I have fought the health fight in DC, in Philadelphia, in South Central Los Angeles, in Watts. You know, I've been all over this country fighting the fight. And the one thing I have learned is, if we're waiting for the white man to come in and save us, we're going to be waiting a long time. So I have no interest in worrying about, you know, somebody else being my savior. We have to save ourselves. And the good news, Lisa, is that we know that it can work. We know we've got viable community organizations. Look at the way our churches can function at their best. When we can pull the church community together, it's terrific. The Black Coalition Against COVID, we're pulling together labor, young people, musicians, artists, visual artists, poets, you know, bringing just a whole group of different minded people together. And what we know is, and we're convinced of it, is that by drawing on our strengths, by looking at our community from the context of their wholeness, that we can take care of a whole lot.
Yeah. Wow. Okay. Wow. So a lot in there. The second point I want to raise around this, the notion that when we interact with the health system, a lot of times it's a negative experience, whether we feel that we're being disrespected, disbelieved, and so on. So there's a trust issue. And I think the trust between the Black community and the healthcare system has been eroded for years, for decades, and it's still true. But I think there's a really important topic we need to discuss related to trust in the context of this pandemic, and that is vaccination. Even before this pandemic, I would say 30 to 40% of my patients were either questioning or refusing vaccination, and that's just a flu shot. So now we are looking, as a country, we are looking to vaccination to be the savior. And I have concerns about that because of the historical distrust, particularly linked to vaccination. But if that's going to be the solution in clinical trials, there's lots of data to show that Black and brown people are the least likely to be enrolled in clinical trials. So if we're not enrolled in the trials, if we're not engendering the trust needed for these trials, and this is the answer to the pandemic, what are we going to do? Won't this exacerbate the disparity we're talking about? What are your thoughts about this?
Well, first, I just love the way you laid out the question, and then within it are the seeds of so much truth and so much focus on what we need to do. Let's be really, really clear here that number one, gets back to our behavior. I understand as well as anyone understands about the Tuskegee experience and the Henrietta Lacks issues in Baltimore at Johns Hopkins. I understand those things as historical issues, no question about it. But at the end of the day, we have got to decide to get past that and move on for our own sake. I remember back when I was health commissioner, it was at the height of the HIV epidemic. Every time I go on the radio or a talk show like this and talk to people about their health and how important it is for a Black man to wear a condom when they're making love to someone outside of a mutually monogamous relationship, the very first question would always be, well, what about Tuskegee? And I
Yes.
would I'd ask the caller, what does that got to do with you protecting the life of your lady tonight? We got to get over some of this. Now, having said that, the people in power in our scientific establishment have got to do a better job as well. There has to be transparency about the clinical trials and what the vaccine is doing and so forth and so on. We have to be transparent about the process of how those vaccines are developed, the safety of them, the efficacy in terms of whether they work well or not. And what are the side effects and what are the dangers? We have to be very transparent in the medical community about that. And so I think it's a combination of both. But what you have intimated is, and I can clearly see the scenario that is about to emerge. Number one, many, many Black folks will resist participating in the clinical trials to test the vaccine. And then when the vaccine comes out, they'll say, well, how do we know it works for Black folks? It wasn't tested in Black folks.
Right.
And then number two, what we're going to say is that I don't want to be taking the vaccine because I think it's going to have a problem, and then we're the ones that are going to then be consigned to the rest of our lives wearing face masks and social distancing.
Oh no, that's terrible.
And then the disparities will get great, and we will be the ones dying, and the white folks will continue to move forward. So we can't have it all. You can't be pissed off and mad and also be able to do and use the therapeutics that are going to be necessary to not have us have this event. So people like us, you and me, Lisa, we have a responsibility to this community. We have a responsibility to interact intimately with the leadership of America's research community that's developing these vaccines. We have a responsibility to be intimately involved and hold accountable the people that are doing the research. We have to be able to say to our people, it is okay to participate in clinical trials because we are watching. You have advocates that are doing that to make sure. And then secondly and lastly, you and I are with others of our colleagues are going to have to then be able to hold the people who make these products accountable for being transparent about how they work, how well they work, what the dangers are, who should get it, who shouldn't, and so forth, so that our community, which is not people that are dumb or stupid, we can make intelligent decisions if we have the right information. But it's going to take all of that, Lisa, to make this happen. But as you said, and I'll end my answer with this, failure to do this well will exacerbate the disparities at a whole nother level. And that really does scare me.
Yeah. So one of the things I've been doing during the pandemic is going out into the community, just walking around. Sometimes I have on my white coat, sometimes I don't.
And your mask.
Of course I have on my mask, and I have pictures to prove it. But asking people, what do you think about COVID and this coronavirus pandemic? And do you know the symptoms? So asking lots of different questions. But I ran into a gentleman who told me, he said, this isn't real, right? And I'm not afraid. And I said, well, why aren't you concerned? He goes, you know what? Faith and fear don't go together. And I thought about that for a minute, and it reminded me of several of my patients and community members who have said to me, God will take care of me. And this is a conversation we don't have enough about, this tension for some people between science, faith, and religion. And I know you've probably heard these things as well. I would love to hear your take on this, because I think there are people out there like this gentleman who thinks, well, we don't need to take these precautions. We're praying about it.
Yeah, so it is a very common thing. First, I just can't let go by that we in this community are blessed with a physician like you who walks the streets with her
I
white coat
love it.
and mask on. Now,
I love it.
I just, I got to applaud my sister. I got to applaud you for that one because that's what we need. But let's remember one little thing about God. God created science too. So let's just not forget. It's kind of like somebody who's like drowning in the sea and he's like, oh God, please save me. Please save me. And a boat comes by and the guy says, no, 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 no. And he passes it up. And the guy keeps saying, I'm the one that sent you the boat,
Right.
But let's also think more dramatically in terms of bringing this home. What that person is really saying is that they are prepared to put their life on the line. And then when they become sick and ill, they are saying, oh, and by the way, I'm expecting another human being who I do not know, who is leaving their family this morning to go work in a hospital, to be able then to risk their life to bail you out. That is the most immoral, selfish, unethical decision that I could ever thought about. In other words, I am prepared to go ahead and risk my life. But oh my goodness, when I can't breathe and I've got these secretions that have to be managed and all of the risk of transmitting this to another person who has to put on a spacesuit just to go to work every day, I'm expecting that person to suddenly bail me out. Come on. That's just not fair. It's not ethical. And there's nothing Christian about that.
Wow. Thank you. Well, this has been an amazing conversation with you. I'm going to let you have the last word and see if you have any words of wisdom or information you want to leave the community with. This has been an incredible conversation.
I've enjoyed it immensely, and I would just say this. I hope that my tone and demeanor have conveyed a sense of the seriousness of these problems. I hope that the gravity of what we are facing and what we will be facing for quite a while is transmitted. But within the gravity and the seriousness of my comments, I hope that I can leave, though, with a statement of love. At the end of the day, what motivates all of us, or it should, is caring. I just have such a love for our people. I care so much about what happens to us. And it is within the context of loving action that we will get the most. If we each love ourselves and love the people around us, if we can do that, then we'll make the right decision. Scaring people has its role, but loving people has a much bigger role.
Wonderful. Well, I love you too. And thank you so much, Dr. Tuckson, for being here today.
Thank
And
you, Lisa.
this is Dr. Lisa signing off. We'll see you next time.